According to UNICEF, the COVID-19 outbreak is currently affecting over 200 countries and territories across the regions. The COVID-19 pandemic has brought human activity to a standstill and now threatens to undermine routine immunization programs. UNICEF says there has been a 70 to 80% decline in planned vaccines shipments as a result of flight restrictions and airspace regulations. Today on Sound Health, we will be looking at the impacts of the pandemic on routine immunization. We begin today's show with the COVID-19 weekly update. I'm Olasumbo Modupe. Welcome.
The NCDC has debunked as false information circulating on social media that prolonged use of face masks by healthy people may cause death. Prolonged use does not reduce oxygen in the blood or the brain and will not make anyone feel weak or lead to death. It urges the public not to remove masks in public places as this can lead to the spread of COVID-19. It says face masks can be safely used by healthy persons over the age of 2 years. As part of efforts to integrate private sector laboratories for COVID-19 testing, the NCDC has announced the inclusion of additional 3 laboratories in Imo, Anambra and Yola. The Federal Medical Center Yola, Everide Diagnostic and Laboratory Services Imo State, and the Aquanalysis Diagnostic Center Anambra, bringing the number of molecular laboratory to 26 in the country. Work is also in progress on the completion of laboratories in Katsina, Kwara and Gombe states. Members of the public are advised not to engage in self-medication based on another person's prescription as this could be harmful. NCDC added that medicines given by authorized medical personnel to patients with diseases include COVID-19 are dependent on individual conditions. To avoid putting others at risk, NCDC says places authorized to be opened should operate under controlled access or adhere to preventive measures such as physical distancing. Meanwhile, Lagos State is considering full reopening of the critical sectors of its economy. Governor Babajide Sanwo-Olu, who disclosed this, said the state government will be rolling out Register to Open initiative as part of the plans that would enable it to assess the level of readiness of the players in the identified sectors for supervised operations. Sanwo-Olu said officials from the Lagos State Safety Commission and the Lagos State Environmental Protection Agency will be visiting restaurants, companies, religious houses and others to assess their level of readiness. He added that with the size of the state's economy and numbers of businesses that operate in its domain, the government could not afford to keep people and businesses on lockdown permanently. Sanwo-Olu urged businesses, religious houses and residents to maintain the status quo while the state works out modalities for full reopening. 10 staff of the government house Marina who tested positive for coronavirus have fully recovered and returned to their baits. Governor Sanwo-Olu, who announced this news, said the disclosure was necessary to further promote transparency in the reporting and management of coronavirus cases by the state government. Sanwo-Olu enjoined banks and markets to strictly enforce orderliness in their premises and directed that elderly people be given priority to transact their businesses in banks and markets between 9 and 10:30 a.m., after which younger customers should be allowed to transact. Meanwhile, the Lagos State government has begun the National Homegrown School Feeding Program at various local government education authorities. The exercise, coordinated by the State Universal Basic Education LASUBEB, is to distribute food to primary school pupils at home. Till date, over 6,000 confirmed cases have been reported in Nigeria, with more than 1,600 recoveries and over 180 deaths. Over 4 million cases and more than 300,000 deaths have been recorded worldwide.
It's still Sound Health on Lagos Television. Today, our focus is on the impacts of COVID-19 on routine immunization. With the help of an expert, we will take a look at how to improve compliance with routine immunization during this period. I am being joined by Dr. Tunji Funsho via Skype. Dr. Tunji Funsho is a physician, cardiologist. is also the chairman National Polioplus Committee of Rotary International, in which capacity he has been working with other stakeholders in the public health sector for almost a decade to see to the eradication of polio. Welcome to the show, Doctor.
Thank you very much for having me.
As an expert, what has been the fate of routine immunization since the emergence of the pandemic in Nigeria? Because on the 26th of March, WHO recommended the suspension of routine immunization. Are there routine immunization ongoing amidst the COVID-19 pandemic?
Oh yes, routine immunization continues. I think that statement that WHO, suspended routine immunization is not true. What WHO was advocating for is, for us to pause the door-to-door immunization for polio because of the risk of COVID-19 transmission.
All right, sir.
But routine immunization, continues. I mean, it will be very disastrous if routine immunization is stopped at this point in time. This is the time we really need to quit it because of some of the obstacles that parents and caregivers, will be having in accessing routine immunization.
Okay, according to UNICEF, the COVID-19 outbreak is currently affecting over 200 countries and territories across all regions. This development has affected supplies of vaccines. UNICEF says there has been a 70 to 80% decline in planned vaccines shipments as a result of flight restrictions and airspace regulation in some countries, to undergo a prioritization exercise for critical shipments for PPEs and the likes.
Yes, I know that normally Nigeria keeps for routine immunization, not for outbreak response. So for routine immunization, I know Nigeria usually has a stock of about 3 months.
Okay.
Of the vaccines that will require for routine immunization. What do we mean by routine immunization? These are immunizations that we give on a regular basis based on a schedule.
Okay.
Depending on what the vaccine is all about. If it is measles, we give measles at birth.
Okay.
If it is polio, we give at 0.
Okay.
When they're born, we give at 6 months.
Okay.
6 weeks, 10 weeks, and again at 14 weeks. And I'm quite certain, as at the beginning of this pandemic, we had, stock normally for about 3 months.
Okay.
So let us situate it, within that. And I'm sure that before we run out of stock, we should, be getting new stock. What is important really is for us to advocate for access, for parents and caregivers, not to think that because of COVID-19, immunization has ceased. Immunization continues, at least I'm aware that in Lagos State, most of the primary healthcare centers that normally give routine immunization still continue to do so with precautions for social distances, not having too many mothers and children at the health center at the same time, making sure they are masked and so on. So what we really need to do is to educate the public and let them know what the new paradigm is as far as routine immunization for the children are concerned. We cannot afford to halt routine immunization for all the antigens that I mentioned.
Okay, we cannot overemphasize the role of vaccines in disease prevention. How can states fill this vacuum and ramp up routine immunization? Because I'm sure there are some states, you just gave kudos to Lagos State now, there are some states that are not permitting ongoing immunization or routine immunization. How can we ramp up?
I believe that it's a question of advocacy.
Okay.
I'm not aware of any state that is deliberately stopping routine immunization, but if there are, we need to advocate those states, that they are creating a lot of future problems.
Okay.
Because if we stop immunization for these diseases I mentioned, particularly those that are very contagious like measles and that has a very high fatality rate, then we will be building up, much more difficulty for ourselves in the future.
Okay.
So I believe that we must, within the constraints of COVID-19 social distancing and all the parameters of hygiene that have been set out to ensure there are no infections in public places and public gatherings, routine immunization can still continue.
Okay, Dr. Funsho, you just allayed the fears of some mothers and the public now. What is your advice to mothers missing out on their children's immunization days?
They should still go as soon as they can. They should still go to their primary health care centers, and they will be duly advised whether that child can have this immunization on that particular visit, or they can reschedule a visit for them.
Okay.
It is very, very vital that all children, particularly below the age of 2, get their immunization as at when scheduled.
Okay, let's assess some myths about vaccines. Before now, many regarded COVID-19 as a flu, recommending flu shots and pneumonia vaccines. Can any of these vaccines protect against the coronavirus?
I don't have any verified scientific information about that. I mean, though the flu is caused by coronavirus, but we all have known over the last 3 months that the COVID-19 virus is a different strain of coronavirus, so it requires its own vaccine.
Okay.
And there are quite a few vaccines that are under trial now. We would never know whether we're going to have a safe and efficient vaccine until the trials are over.
Is Nigeria included in this?
Well, I believe that Nigeria has applied to be part of the trials of one of the vaccines.
Okay.
And I'm sure in due course all the due protocols will be followed under the normal guidelines for testing of drugs, which is under the ambit of NAFDAC.
Okay.
And if all the protocols are followed, I'm sure it's a good opportunity for us also, because vaccines, may work in one demographic area, may not work in other demographic areas, and that is why it's important to have a multi-faceted and multinational trial of these drugs, just to make sure that it works in every gender, it works in every age, it works in every race, and so on. That is the only way we can be sure that this vaccine is safe and also efficient.
Okay. All right, Dr. Funsho, let's take a look at the race for a COVID-19 vaccine. As part of WHO's response, the R&D blueprint was activated to accelerate diagnostics, vaccines, and therapeutics for these novel coronavirus. Where are we presently?
Well, as far as I know, if we're talking about therapeutics, some of the drugs that have been earlier touted have not shown too much, promise in terms of actually being safe and efficient.
Okay.
Protein phosphate is one of them. The other one, remdesivir, which the American Center for Disease Control approved on the 1st of May for use. I guess, we have just to wait and see. I personally am not too impressed, by the kind of, how shall I say, hurrah moment when it was announced, because it has not been shown to reduce, deaths. It has only been shown to reduce the number of, stays in hospital. It has the number of, fatalities as the difference between the control and those who use remdesivir was only about 4%. In my view, it's not very significant.
Okay.
But until we use it on a very, very large scale, we will never be sure whether it is. Just remember, remdesivir was developed for Ebola. It didn't work. It's been on the shelf, so it's just been dusted.
Okay.
I think only time will tell us, whether we found an effective drug. Always remember there's an economic aspect to this race to get whether it's a therapeutic agent or a vaccine.
How true is the fact that a vaccine could take up to 2 years to develop? For COVID-19, we will need about 7 billion doses of vaccine.
The development stage is the long one. Prior to this time, A vaccine will take between 3 and 10 years to develop.
Okay.
But because of the emergency that we are in and the fact that, there have been work done previously on the coronavirus, it is easy to jump, some of the animal studies
Okay.
and go into, human studies to determine first of all, that it is safe to use this vaccine in humans. And then the next phase, which is the phase 2, which is a small group of people again, is to see, whether it is efficient in raising immunity and at what dose. It's only after that, the large-scale, phase 3 trials are undertaken in a large number of population, and then you now evaluate. It's only after that you can now say whether or not this vaccine is going to be useful for giving people immunity against the virus, or it's just, one of those many that fell by the wayside.
Okay, what will be the routine once a vaccine has been approved?
The routine, I would just guess, because right now nobody knows.
Okay.
It is only after, the end of the third phase, and you do, the post-deployment mobilization and get all your data as to did it work, in what age group did it work, and what is the level of immunity that it creates, that scientists will not be able to advise us. Is it something that you give once, or is it something that you need to give a booster dose?
Okay.
Like some vaccine currently in use. So we will never know that until the strict trial is concluded.
Okay, earlier on in your response, you said Nigeria also applied for vaccine trials and all that. What is the future of vaccines development in the country?
Well, I think we must use this opportunity, because we used to produce yellow fever vaccine, in the Nigerian Research Laboratory here in Yaba, but somehow it got neglected. We have the human capacity, and all we require is to put the resources at their disposal, and Nigeria will be able to produce any kind of vaccine. So I hope, this is a wake-up call for the Ministry of Health to reactivate vaccine production center in Yaba and anywhere else they may deem fit to put it. But we have the human resources and capacity. We have some of the best virologists in the world, in Nigeria. So that will not pose a scientific problem. It's something we can do.
Okay, thanks so much for the clarification. We are now enlightened that we shouldn't expect a vaccine soon. And in that case, going forward, what is your advice to the public in terms of precautionary measures against COVID-19?
I think the fundamental thing really remains stay at home. I know many people don't want to hear that, but that is your best and 100% assurance of not getting the virus and also not spreading the virus.
Okay.
Be that as it may, we know that not everybody can stay at home, but let us be with those who can afford to stay at home to reduce the disease burden by staying at home. That is one. The second thing, of course, is to follow the guidance about social distances. Because we know that this disease is spread by droplets, and so even speech, particularly forceful speech, can spread the disease. Again, we know that between 30 and 80% of people in some environments will actually be harboring the virus without knowing it, either because they're in the preclinical stage before it manifests, or throughout the time that they are harboring the virus, they really don't come down sick with the virus. So when you have that high population of people outside, you need to protect yourself from people, and you need to protect people from yourself. So the next best thing is wearing a mask when you're in public.
Okay.
And even then, try and keep social distances.
Okay.
And of course, hand washing still remains a paramount thing. And you must ensure you go out of your house, you come back, you wash your hands. If you touch surfaces, that is in a public space, wash your hands or use your hand sanitizer.
Okay, before I let you go now, many have called for homegrown solutions. What's your take on this? We've had several claims by some professionals What's your take on homegrown solutions?
You see, homegrown solution means what? If we're talking about contemporary drugs, we're capable of doing so. We have the research capacity. We only need to provide the resources. If you're talking in terms of herbs, most of these, are chloroquine, gradually, evolved from quinine that was from the bark of cinchona tree.
Okay.
We all know if, those of us who grew up, who were young during the time of the first flu pandemic,
Okay.
in the late 50s, we knew that there were no vaccines, there were really not much drugs, but my aunt made sure that we had some very, very pungent herbal preparations, and I can tell you they were effective. We also know from science that ginger is an antiviral agent,
Well,
and so in whatever form we can use it, it is useful. So there are quite a number of herbs that can be useful for this purpose. Our only challenge is to be able to know how much of it, how frequently it needs to be used, and I think it's within our capacity to do that. So I don't, go with those who say, we cannot have homegrown remedies. We have either in terms of, modern medications or in terms of using herbal medications that we have here. I don't think we should throw that away.
okay.
What we need to do is to ensure that we find a way of producing it under hygienic conditions, standardize it so that we can tell people, have a cup in the morning, have a cup in the afternoon, have a cup at night, and so on. I think it is something that we should look into because I know for certain there are, herbs that are antiviral in character. In other words, they can kill viruses. But what we don't know is the specific, way to use it so that you can get the same results, over and over again,
Okay.
which is what, modern, pharmaceuticals are able to do with, most of the pharmaceutical agencies that we have in the market.
Okay.
So we need to do some research on that as well.
Okay, Dr. Funsho, we really value and appreciate your time and resources on the show today.
Thank you very much for having me.
We have been talking to Dr. Tunji Funsho on the impact of COVID-19 on routine immunization and ongoing efforts to develop a COVID-19 vaccine via Skype. Dr. Tunji Funsho is a physician and cardiologist. He is also the chairman, National Polioplus Committee of Rotary International. The show continues with trending health reports. Please stay tuned. This week, the World No Tobacco Day is observed. In this package, we highlight the effects of tobacco consumption on health and efforts by medical experts to discourage consumers. There is no vaccine to prevent COVID-19. Other measures such as physical distancing and quarantine have been implemented by many countries to slow the further spread of the virus. Please embrace these measures to stay safe. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.